Here is an example of a vision test that was required by periodicity but was not performed because the patient had her vision tested 3 months earlier and the results were within normal limits. Note the format at the explanation in the Comments Problem section. The number of the screening procedure is listed with a 0 in front of it to match with the numbering of the procedures under the CHDP Assessment column. Column C is New Problem Suspected, and Column D is Known Problem Suspected. For both columns, you will use follow-up codes listed on the PM160 above the referral boxes. Make sure to write in an explanation in the Comments Problem section. An explanation is required for any marks in columns C or D. Be as descriptive as possible in your explanation. Here is an example of markings in column C, Problem Suspected, New. This patient was diagnosed with otitis media and is now under care for a URI. We will go over follow-up codes in the next few slides, but note the formatting of the follow-up code in the Comments Problem section. The 0, 1 refers to the screening procedure. The 3 and the 1 in the parentheses refer to the follow-up codes listed above the referred to boxes. Before we move on to learning about the follow-up codes, remember that when marking column C or D, you must write a follow-up code in the box that matches your action and medical record. All problem suspected responses require a comment to be entered into the Comments Problem section, giving the diagnosis, if applicable, and a plan. Now we will go over the follow-up codes. Follow-up code number 1 is no diagnosis or treatment indicated, or patient is now under care. An example of this would be a dental problem that is currently in the process of being treated. Follow-up code number 2 is for a questionable result and a recheck scheduled. You will enter this code if the accuracy of a test result is questionable. A child can be brought back for 1 repeat test only. If a second failure occurs, refer this child for a specialty evaluation. Follow-up code number 2 can be used only for screening procedures 6 through 26. A fee may be charged for this screening procedure, even though the result is questionable. There is no minimum interval required between rechecks. However, there are recommendations for certain screenings. For example, if a child fails an audiometric screening test, this child should be rechecked in 2 to 8 weeks, per California Medical Services recommendation. If a child fails or cannot perform the vision, audiometric, hemoglobin or hematocrit, or urine dipstick screening, use follow-up code 2 on the first PM160 and schedule a revisit. When you are completing the second PM160 during the recheck, make sure to mark the screening procedure recheck box and include the original CHDP exam date. As stated, if the child fails the second screening, refer them for a specialty evaluation. Follow-up code number 3 is when a diagnosis is made and treatment is started on this visit. When using this code, you will enter diagnosis in the Comments Problem section, as well as the ICD-9 code in the Diagnosis Code section. Follow-up code number 4 is used when a diagnosis is pending and a return visit is scheduled. Use this code if a return visit has been scheduled for diagnosis and/or treatment. This code is only to be used for assessments 1 through 5. Follow-up code number 5 is referred to another examiner for diagnosis or treatment. You can also use this code if a diagnosis or change in chronic condition has been identified during the exam and the patient has been referred to another provider or regular specialist for treatment. Follow-up code number 6 is referral refused. You will use this code if the patient or the responsible person has refused referral or follow-up for any reason. Please note, CHDP does not pay for diagnosis or treatment services. You can bill Medi-Cal if the client is eligible, or if they have gateway codes 8W or 8X, which means they are eligible for care for the month of service plus 1 month after. If the client has gateway codes 8U or 8V and they are under 1 year of age, they are automatically eligible for full scope Medi-Cal until their first birthday. If the client has gateway code 8Y, then they are eligible for CHDP services only, not for Medi-Cal. Refer these clients to an LA County facility, such as Long Beach Comprehensive Health Center or Harbor UCLA, with a pink copy of the PM160 and 161. As a reminder, all screenings require a result. In the Comments Problems section, make sure to document the Snellen result, audiometric result, TB result, head circumference, language spoken if not English, hemoglobin or hematocrit result, and an explanation for any tests or immunizations done outside of periodicity. You can only bill for either urine dipstick or complete urinalysis, but not both. If you get a positive tuberculosis result, record the result in millimeters of induration in the Comments Problems section. If the child is less than 6 years old, send a confidential morbidity report, or CMR, to the Long Beach Department of Health and Human Services. Then refer this child to LBDHHS if younger than 3 years, or to Long Beach Comprehensive Health Center if 4 years or older for a no-cost or low-cost chest X-ray. Here is an example of a negative tuberculosis test. As you can see, box A, no problem suspected, is checked, and in the Comments Problems section, the number of the screening procedure is written, then confirmation that this child was determined to be at high risk for tuberculosis, the date that the test was read, and the results in millimeters of induration. Next, we will go over measurements taken during the well-child visit. Measurements are written above the immunization section on the left-hand side of the PM160. Height must be recorded in 1/4 inch increments. Weight must be recorded in pounds and ounces, filling in all spaces with zeros as needed. Body mass index, or BMI, must be calculated and documented for all children ages 2 and over. For this measurement, make sure that you are recording the BMI percentage found on the appropriate growth chart, not the actual BMI index. Blood pressure must be recorded for children ages 3 and older. Birth weight must be recorded for children up to age 2. Once again, this measurement must be recorded in pounds and ounces, filling in all spaces with zeros as needed. Finally, head circumference must be recorded for infants up to age 2. This measurement needs to be recorded in the Comments Problems section of the PM160. Now we will look at the immunizations provided by CHDP. Immunizations are recorded underneath the Measurements section of the PM160. To document immunizations, you will check one of 4 columns. Columns A and B mean that you gave the immunization today. Column A means that the child is now up to date for this immunization, and column B means that this child is still not up to date on this immunization. Columns C and D mean that you did not give this immunization today. Column C means that the child is already up to date on that immunization, and column D means that the immunization was refused or contraindicated. If a child is due for an immunization for their age per the periodicity schedule, and you are not giving an immunization, you must document this immunization and check either column C or D. Finally, you will use the fee schedule to document the correct code for each immunization. There is a specific code for each type and brand of vaccine. For example, DTaP has a different code and reimbursement rate than DTP, and all the hepatitis B vaccine variants are different. Make sure that your biller has a list of the correct codes. These codes can be found at www.dhs.cs.gov.chdp. This is an example of a hepatitis A vaccine. The vaccine code is written, followed by the name of the vaccine. This child received this vaccine today and is, as a result, up to date for his age. The correct fee for the vaccine is written in the fees column. Now take a look right below the immunization section. There are 4 boxes: new patient, routine visit, initial screening, and periodic screening. If you check New Patient or Extended Visit, this means that this is this patient's first exam with you, or that this patient requires as much time to assess as does a new patient. If you check Routine Visit, it means that this client is already an established patient in your office. You must check one of these two boxes. Please make sure that when a patient requires an extended visit, you record in detail the reason for the extended visit in the Comments Problems section. Be aware that extended visits are scrutinized heavily by CHDP. You are encouraged to use extended visits sparingly. If you check Initial Screening, it means that it is this patient's first CHDP exam with any provider. If you check Periodic, it means that this patient has received a previous CHDP exam with any provider, even if it wasn't in your office. You must check one of these two boxes. Now we will move down the right side of the PM160. First, we will go over referrals. Right above the Comments Problems section are the referred to boxes. Make sure that anytime you use follow-up code number 5, the referred to box is filled in. Routine dental referrals are recommended for all children 1 year and older. Do not check this box if there is a dental problem identified, as this would no longer be classified as a routine referral and would require a different follow-up code. Routine lead screenings and referrals occur at 12 and 24 months of age. Make sure that if a child has missed a lead screening or referral at either of these age markers, that they are brought up to date as soon as possible. Lead poisoning can have permanent effects on the physical and mental development of a child. Therefore, anticipatory guidance should be part of every visit for children between 6 and 72 months of age. Under Additional Screenings, you will write code 23 for lead testing. This codes for blood drawing for lead testing and anticipatory guidance for children up to 2 years of age. Code 24 is for lead referrals. This codes for off-site blood drawing for lead testing for children up to 2 years of age, in addition to anticipatory guidance. ICD-9 codes are required for any problems that are diagnosed. There is no need to write in the well-child visit code or a decimal. However, anytime follow-up code number 3 is used, the ICD-9 code is required, as well as documenting the diagnosis in the Comments or Problems section. Directly below the space for ICD-9 codes is the space to write the answers to the tobacco questions and women, infants, and children status. At each complete screening visit, all tobacco questions must be answered. Please use this opportunity to counsel the patient about the dangers of tobacco use.